And we were just mentioning that violent weekend here in Chicago. Local leaders and advocates, they're all calling for more community violence intervention efforts. Joining us with more is Dr. Chico Tillmon, Executive Director at the University of Chicago Crime Lab's CVI Leadership Academy. Good morning to you.
Good morning, and thank you for having me.
Absolutely. Well, yesterday in a speech at the Democratic National Convention Drafting Committee hearing, you said that we need to see not just more harsher punishments, but more community violence intervention efforts. Could you provide some examples of what you're speaking of?
When you think about harsher punishments are a response to something that's already happened and the community has been harmed and victimized. What we need to see is more frontline workers working with individuals at the highest risk of both victimization and being a perpetrator of violence prior to them committing the act, to stop these atrocious acts from happening in our most vulnerable communities.
And Mayor Johnson has said that he's asking for more financial help from the federal government. How do you think that that money should be spent?
I think a lot of times we think about investing in CVI as almost charity. But what we've learned at the Crime Lab, based upon research, is for every dollar spent in CVI or invested in CVI, there's a $4 to $20 return from a societal perspective. So we have to invest to help save the economy, but also to help make communities safer and healthier.
And you also say that we need to address the root cause of gun violence. This is obviously a very complicated topic, but where do we even start with that?
When you think about it, in vulnerable communities, typically there are broken school systems or community-based community schools, so we need to invest in schools. One of the things we've seen that's been helpful is high-dosage tutoring from our programs like Choose to Change, but also in housing. People who are at the highest risk have to be in survival mode in communities where they've already had conflict. Even individuals who enter programs like CRED or READY have to return to those communities where they've been harmed or inflicted harm on others, and it makes it difficult for them to go into a pro-social lifestyle.
And you mentioned that community violence intervention programs, how exactly do those work, and how can they maybe help reduce some of the violence that we've seen, especially, really, this has been going on for years and decades here in Chicago?
One of the things we've seen that's most effective is through relentless engagement and engaging individuals who either have shown past violent behavior, through referrals from the criminal justice system, through algorithms of social networking that show individuals who are most likely to commit these violent acts, but also through community referrals, individuals in the communities who have identified individuals who are on the cusp of committing violent acts. So by also taking a collective, cohesive, comprehensive approach toward it in the same way we did COVID. So we need everybody involved from all sectors to address violence and take this public health approach so that everyone is involved in reducing violence by opening up opportunities for individuals, but also giving individuals an interest into back into mainstream society.
It definitely takes a village for sure. Dr. Tillmon, thanks so much for your time this morning.
Thank you so much for having me, and have a blessed day.
You as well.